Bom dia, good morning, and thank you very much to FNAM to inviting me to participate in this junior doctors meeting in Coimbra. I would have loved to be there because I really love Portugal and especially Coimbra, but unfortunately I have a personal commitment that I had from before, so I cannot attend. But I wanted to be present and to be able to convey some of the perspective of how junior doctors are in Europe at the current moment. So thank you very much for also allowing me the opportunity to present, even if it's through a video. So what I wanted to do today is to present the main challenges of junior doctors in Europe as of today. So first, in order to do it, I would like to do a short contextualization of the situation of junior doctors within what we call the health workforce crisis in Europe. So what is this crisis? Is this paradox in which right now, in spite of having the most amount of doctors in history, we are facing certain problems in terms of shortages, in particular regions and specialties. So what is happening, and this is highlighted in this loop, is that we have experienced problems with medical workforce planning due to many factors, the absence of planning altogether, the consequences of the 2008 economic crisis, the COVID pandemic, and so on. Also the aging of the population and the consumerism trends which are increasing in the healthcare system, and this is creating and deteriorating the working conditions of junior doctors and doctors altogether. So what this is happening is that it's impacting on negative work experiences and decreased job dissatisfaction or increased job dissatisfaction of junior doctors, and this in turn is creating problems for retention. So we are losing doctors, we are bleeding doctors. It's not that we need to increase recruitment, that in some cases that might be the situation, but it's that the doctors that are currently working, and in particular junior doctors, are facing problems in relation to their work experiences which are driving them outside of the workforce. So this is creating attrition and also in the context of, as we were saying, an increase in demand. So what we wanted to do as the European Junior Doctors Association, that probably some of you know about it, but the ones that you don't know, we are an umbrella organization which represents 25 national junior doctor association from across Europe. We are mostly a EU-based country. So in the case of Portugal, the member of our organization is the Orden dos Médicos through the Conselho Nacional de Internado Médico. I probably didn't pronounce it well. So these are our members. In other countries such as Spain, it's the National General Medical Council. In the other countries such as the UK, is the BMA. So it's the most representative junior doctor organization of the country. So what we tasked ourselves to do in 2023 was to understand a little bit better the situation of the workforce, and to do that we conducted a qualitative survey which focused on interviews to individual representatives or focus group with representatives from different countries of the 25 national member organizations that we have, to understand a little bit more in depth about the situation that junior doctors were facing. And we hired a consulting scientific firm which helped us with that. And what was curious for them or striking for them was that uniformly across Europe, junior doctors were facing many challenges compromising both patient care and their own well-being. And this is the word cloud that emerged out of the interviews. When they asked about how junior doctors were feeling, they said stressed, pressured, exhausted, forgotten, frustrated, insecure, harassed, afraid, and so on. So we could say that the situation was complicated and is still complicated. What we did in this study was several things. Well, the first thing is that we wanted to have an overview of the situation of junior doctors. So what we did was to understand the big trends that we are facing right now. So what we saw is that there is a big shared disappointment and job dissatisfaction among junior doctors that has to do with the working conditions, the workload strains due to the heightened healthcare demand, due to the factors that I was mentioning in the beginning. Then there is a generational shift in the attitudes, the values that different generations have, and this generation, as any generation in the past and the generation that will come along, we have different attitudes and values towards work. And these also have to do with the problems that we're facing and the things that junior doctors will stand or not stand in the future. So this is what leads us to the fourth point, which is a redefinition of the professional calling, or this vocation that is sometimes mentioned in the context of medicine. So it's this professional calling that people have that makes them choose a particular profession, that sometimes has been the driving force of withstanding working conditions which are not adequate for junior doctors. So what we're seeing on top of that is that this is a phenomenon which is a little bit difficult to pick up, because it's easier to understand migration flows because you have sending countries and receiving countries that can send information. But what we cannot track this much is this trend of rising resignation from clinical roles. This means that like colleagues of ours, for instance, I have several examples in my close circle of people that have done medical school, that have undergone their PGT, and then after that they don't want to practice anymore, and they do a different thing that has to do with research, going into private companies, and things that have to do with their training as highly skilled professionals, but that is not clinical work. So this is a problem because these are highly trained professionals that have been trained for 12 years, so it's not something that we can just create out of the blue, and that, I mean, it's not that they don't want to work, it's that probably that the conditions that they have been working in prevents them from continuing in the work. So this is also changed the shift in specialty and career choices among doctors and junior doctors. So right now the most trendy specialties across countries are not the same ones that used to be trendy some years in the past. And work-life balance as an important goal is one of the things that have been appearing on a center stage in relation to these choices. Then we are still facing gender inequalities, even if the workforce is now more female than male and is going to be increasingly more female than male. There are still gender differences in terms of representation, pay gap, and work-life balance, and how the social structures of care are defined and work, and the way in which the employers do not accommodate for these caretaking responsibilities, be it having children or taking care of people with disabilities or your elderly family members. And then what we're seeing as well is that the increase in migration due to the free mobility of professionals in Europe, and also the receiving migratory trends from outside Europe, we're seeing that there are cross-border mobility-related experiences in which sometimes, or more often than not, junior doctors that come from abroad experience shortcomings, not feeling welcomed, and also some forms of discrimination. So we wanted to develop a framework to understand the job satisfaction of junior doctors. So we understood that they have to do, or the junior doctor satisfaction is based on 3 pillars. The first pillar is the work-related experiences. So they will be impacted by the workloads, the working environments, the compensation concerns, the lack of flexibility or the presence of flexibility, and the mobility and employment capabilities. Then it will be also about the training-related experiences, so doctors undergoing PGT, postgraduate training or specialist training, feel, and in many cases they have presented the perspective that when training outcomes are when training goes against service delivery, because there is a lot of work to do, service delivery is the thing which prevails. So sometimes it's not that important to focus on if a junior doctor has attained the competencies or the training programs. It's just that they have worked. And this is something which is highly problematic. So there needs to be a balance between these two aspects of the service delivery and the role of junior doctors within the healthcare system, but we should also be attaining our competencies in a safe way with adequate supervision. So this is an important part of job satisfaction in junior doctors. And last but not least is work-life balance. As we were saying before, workloads are increasing, working hours are very dire. We will be presenting shortly as EJD the first European-wide survey about working hours of junior doctors. There will be results about Portugal and other countries, and also comparison between countries. But what we're seeing is that there is a widespread non-compliance with the national working hours legislation as well as the European Working Time Directive. So this is just a heads up, so it will be appearing soon. It was coordinated by one of your country members, which is our executive board member, David Beranu. So keep us in the keep following our information, because you will be receiving some information in the upcoming months. So there are big implications of ignoring this crisis and the situation of junior doctors, which is a threat to the sustainability of healthcare system. It is a patient safety concern, and it's also an increasing deterioration of professional well-being. So we have several solutions that we propose, I would recommend to look at the report, which, as I mentioned in the beginning, is called From Tradition to Transition. You could see it either on the first slide, or you could do it also on our webpage, just typing From Tradition to Transition. And there are many conclusions and many solutions that we propose. I'm not going to get into all of those because I don't want to bore you and I have a limited amount of time, but it has to do with changes in governance, about putting the workforce in the center of healthcare system and healthcare system policies. It's about investing, it's about improving the working conditions, it's about work-life balance, occupational well-being, about improving training and addressing those inequalities. But as I was saying, it's also about making healthcare workforce and health workforce and junior doctors at the center of healthcare policy, and that is also our role as professional organization, and that will be also, I would say, your role as the trade unions. And I think we should work together as we're doing right now, and increasingly and more coordinatedly at the European and national levels in order to achieve those goals. The last thing I wanted to mention is that last year we created this report. This is a second report, which is called From Mandate to Motivation, that has to do with retention strategies in Europe and the perspective of junior doctors on those. So what we saw, or what we are seeing, is that since we are having this problem of workforce shortages, and alongside this problem is also the phenomenon of medical desertification, which means, or which refers to certain regions not being able to adequately cover service delivery and not finding enough professionals to provide care. That could be rural regions, but it also happens in cities, and in some cities in the outskirts of the cities, or in some neighborhoods. And it relates to many different factors that have to do with like workload, that have to do with like being able to afford to live in cities or in rural areas, about to being able to create a career path, or to have like a life there with your family and your loved ones. So it's a complicated subject, and if you want to understand more, I would recommend to read this paper. But what we were seeing is that since there is like some lack of professional in certain areas, there was an increasing trend of countries trying to develop forced allocation measures, which means measures in which a junior doctor or a medical student or a recently graduated specialist are forced to work in these underserved areas under the penalties of fines or other forms of punishment, and in the end makes them like a coercive practice in terms of retention. And we wanted to denounce those practices and to reflect the way that they have not worked in other countries, that they in the medium term they create even bigger dissatisfaction, and to promote motivational allocation practices and motivational practices in terms of retention, which means creating incentives, allowing people to have like better work-life balance, more flexibility, even if it's rural areas, to improving or making it easier to the families to settle in, or having like even bonuses, or in terms of like where to stay, your housing. It depends. There is a wide array of measures that can be understood, and there is like a set of best practices and suboptimal practices. But the main point is that motivational strategies work better based on the available evidence and the perspective of junior doctors than coercive practices. That will be the first idea. The second idea has to do with the fact that in order to create retention strategies, you need to ask professionals, and junior doctors in particular, if you want to retain junior doctors, and if you don't take into consideration their perspectives, you're going to probably fail. The third idea is that there needs to be like a comprehensive approach to retention and to this human resources planning, and it needs to take into account several measures and to be planned in advance or in the future. It shouldn't be like a short-term measure, because then those things tend not to work, and a set of comprehensive measures. And the last message has to do with the fact that evaluation is key. So we need to evaluate those policies. We need to have publicly available evaluations so that we can know what works and what doesn't work. And if the fact that something works in a country could potentially show that it could work in others, but it needs to be contextually relevant. So that's why evaluation is key, and publicly and transparent evaluation. So this is the report as well. I think those two reports encapsulate well the situation of the workforce, and then we are going to, as an organization, delve a little bit deeper in issues such as I was saying, working hours. So like follow us and you will see a little bit more. And I think this kind of sets the stage and provides a European perspective of situation of junior doctor that I think would enrich your conversations. I would have loved to be there, and I'm sending you all my best and a very successful event. And if you need anything, you can contact us through the official means of communication that you can find on the website. So thank you very much, and see you soon.